Hello everyone, I'm happy that the second tobacco control talk of the World Federation of Public Health Association is starting. And I'm very happy that we have an amazing second guest from Australia. And yeah, I think we can get right into it at the moment. So you are very curious about your background and your initiative. So you are an oncologist, a tobacco control advocate, you are the founder and CEO of tobacco-free portfolios, and I would be very interested. How did you get involved in tobacco control? So what is your background? How did you get started? And what is tobacco-free portfolios about, especially for those who don't know it?
Okay, well, thank you so much for having me here today. And it's great to connect with so many people from all around the world. So hello to you all. Good morning, good afternoon, and good evening, depending on where you are. So yes, my background is as a radiation oncologist, and I started my career 20 years ago now, working as a very first job after medical school, working on the lung cancer ward at a very big cancer hospital in Melbourne, Australia. And, you know, I was a new doctor planning to do good things, and I really wanted to help people. And I found that despite living in, you know, a very wealthy country with access to fantastic medicine and great technologies, nearly all of my patients on the lung cancer ward at the Peter MacCallum Cancer Centre, nearly every single one of them died. And so it was a very brutal start to my medical career, when I realised that of all of those patients, nearly all of them were smokers. Nearly all of them had started smoking when they were children or teenagers. Nearly all of them had tried to quit at some point. And despite the good fortune of being in a high-income country with great medical care, you know, we really had nothing to offer them. And I was watching people in their 40s and 50s die. You know, sometimes I was the one who had to call in families to say the last goodbye, and I'd have to, you know, watch people pass away right in front of my eyes. So it was an absolutely shocking way to start medicine, and it was really, you know, just a very brutal wake-up call to the reality of tobacco. Of course, I knew tobacco was bad. Everybody knows tobacco is bad, but when you really see the impact firsthand, it really just becomes, you know, something that it's hard to stop thinking about. And so it wasn't until many years later, I found out completely by accident that my compulsory pension plan in Australia, we have a compulsory pension system, my money in that pension plan was being invested in big tobacco. And by that stage, I was a specialist working at that very hospital. And I'd watched hundreds, if not 1,000 or more people die from tobacco. And then I found out that my money was invested in the companies that made the products that killed my own patients. And so from that point on, I just thought there was a big missing piece of tobacco control. And while there are so many, you know, really amazing tobacco control workers all around the world that are focused on especially policy and regulation and connecting with children and making sure that children and teenagers really understand the harms of tobacco, you know, there's all the parents and communities out there and teachers who are trying to help that next generation. There's so many people doing good things, but up until really that point, the finance sector had been left out. And the real sort of shock to me was that the most normal thing is that pensions all over the world invest some of your money in tobacco companies. Then I found out that banks routinely lend money to tobacco companies, insurers insure tobacco companies, and all the big financial organizations invest in them. So to me, it just seemed like this missing piece of such a big and complex and systemic and generational problem. And so I set up, first of all, it just started as a very small piece of work on the side of my oncology career, but eventually it sort of took over my life, and I set up, it's an NGO, so it's called Tobacco-Free Portfolios, and we work with the finance sector and encourage the finance sector to learn more about tobacco and to reconsider their normal policies of lending, investing and insuring tobacco companies. And so my whole life sort of really spun around, and now I spend much more time with the finance sector than I do with the health sector.
And how is this affecting like the people who are listening? Does this mean that most people all over the world are somehow investing in tobacco companies? Are we investing in tobacco companies? How does this look like for most people?
Yeah, well, it depends on where you live and which country you're in. But since our work began, we've tried to, first of all, I just started in Australia for many years and then started to work in different countries. And our work has made an impact in more than 20 countries now. And I've got colleagues that are in 4 different countries, especially focused on the biggest financial markets. But what we've learned is that if you take the top 300 pension plans in the world, only 30 of them have implemented a tobacco-free finance policy, so it's only 10%. If you look at the top 100 banks, only 9 of them have policies to not lend money to tobacco companies. If you look at insurance companies, there's just a couple that have tobacco-free policies. So there's an awfully long way to go, but it really will depend on which country you're in. And often it is tied in with how robust the country's tobacco control regulation is. And obviously I'm so fortunate to live in Australia, where there's been so many very bold policies in tobacco control implemented for decades and decades. And so when I went to the finance sector was ready for the discussion because it made sense. Everything else in Australia is tobacco free. So why wouldn't finance be tobacco free? And so when I've gone to various countries in Europe that have very strong tobacco control policies, the same thing. It's just been a very logical next step. But depending on where the listeners are, there would be a very high chance that they are investing their own money in tobacco companies, and that they have a financial relationship with a bank that if they're putting their money in a deposit in a bank, the bank takes that money and invests that money. It's highly likely that that money is either being invested in tobacco companies or that that bank is in fact lending money to tobacco companies. The same thing goes for the insurance company you're working with. So it's a very high chance. And even though we're very happy that we've made so much progress, everyone always tells me the hardest thing is to go from 0 to 10%. When you're trying to change anything, it's that first bit that's really very difficult. So that is wonderful, but we've got a long way to go.
Okay. No, this sounds amazing. And you did make a big shift, because I learned that almost 11 trillion US dollar were shifted by your NGO and by your initiative. How can we imagine this? How does it look like? Because I'm not involved in the financial sector, so this is a different world for me. How did these financial institutions react when you first approached them, and what were your biggest challenges, and which things were kind of easy, maybe even because you said sometimes they were quite open to your ideas? Yeah,
look, it totally depends on which country I'm in. And then within the country, it depends which organisation it is. And within the organisation, it depends on which person I meet.
Okay.
So there's many factors at play. So, I mean, the best case scenario would be a country that already has strong tobacco control regulation, an organisation in the finance sector that is progressing well on the journey to sustainable finance. So many people, even outside of finance now, have probably heard about this big global shift that we're seeing from sort of old-fashioned finance, where the finance sector only ever thought about money. And of course, the finance sector thinks about money. That's what it does. And it's very important that everybody has a comfortable retirement. So of course, pensions need to be very financially robust. But especially in the last 10 years, globally, there has been a phenomenon whereby the finance sector is being called upon to think more broadly than just about money. And they're thinking about stopping doing some things which are the worst things for humanity, the worst things for health, the worst things for the Sustainable Development Goals, the worst things for the environment. And instead, they're thinking about what are the positive things that they can do to improve the world's health, to improve the likelihood that we're going to achieve the Sustainable Development Goals, and to improve the quality of the air we breathe and the oceans that we swim in, So there's been this big shift, and every financial organisation that we meet is somewhere on that journey from the old way to sustainable finance. And the more advanced ones are far more open to the discussion around tobacco-free finance, because really it really is the easiest step on the journey to sustainable finance. And you know, some issues require a huge amount of resources and a lot of data and a lot of information, and you know, and really when it comes to things like climate change, that takes, we'll be working on that forever. We're never, you know, that's never going to slip off the agenda. Whereas tobacco really is a very black and white issue that can be dealt with relatively quickly.
Mm-hmm. And what might also be interesting, because one of the mechanisms you're using, you created the Tobacco-Free Finance Pledge. Can you tell us a bit more about it? What is this, and how could people get involved, or how could institutions or countries get involved?
Yeah, so the pledge is an initiative that we worked on. We spent a year or two developing it in concert with 3 different UN agencies. So there's 3 UN agencies that are focused on sustainable finance. And so we partnered with all of them. We also partnered with 3 big corporate organizations, and we developed this pledge, and it's a very good spirited, forward-looking pledge that encourages people to come on the journey to sustainable finance by going tobacco-free. And so we launched that initiative at the United Nations in New York on the sidelines of the UN General Assembly in 2018. We had the support of President Macron of France, and the Australian Prime Minister at the time was Prime Minister Malcolm Turnbull, and we had their support, so we were able to launch it at the United Nations. At the time of the launch, there was just under 100 financial organisations that had signed up, and now today there is 147 as of today financial organisations that have signed up, and they come from more than 20 different countries. And they include some of the world's largest banks, insurance agencies, sovereign wealth funds, pension plans, and they control a total of almost exactly $11 trillion US. So, you know, this is our flagship initiative, and, you know, we welcome any discussions from financial organisations at any point in the journey, from the very first conversation around tobacco-free finance, right through to sort of the details of how to implement the policy.
Okay, and what was the response of the tobacco companies to tobacco-free portfolios, or to the work of tobacco-free portfolios?
Yeah, well, look, of course, we don't, you know, like any other part of tobacco control, we know that that the tobacco industry really tries to push back, you know, using all sorts of different angles and techniques. And so, of course, you know, as expected, they've pushed back in various ways. They've managed to secure the services of some very high-profile people in sustainable finance who are probably watching this now, which is absolutely shameful of them. But they have, you know, they have decided to work for tobacco companies and push their you know, push their narrative into the sustainable finance community. The tobacco companies have tried to adopt the word sustainable. They've tried to adopt the concept of sustainable finance. They've tried to ingrain themselves into conversations around the Sustainable Development Goals, and at the same time, they continue to sell products that you know, that kill 8 million people every year. So that duplicitous nature of tobacco companies has continued. It's probably accelerated, especially during the COVID crisis. We've seen all sorts of just absurd activity, which I'm sure your audience is well aware of. But we certainly, you know, we know that our work is on their radar, but that means that, you know, it's certainly making an impact. And so, you know, we take it as a compliment.
Okay. And you mentioned like COVID-19, which is obviously like the big political topic or the health topic at the moment. How did this change your work, or the work of tobacco-free portfolios?
Well, it stopped me flying, so I'm feeling more well rested and refreshed than ever before. So previously, I would spend a lot of time, meeting people in different parts of the world. So now I just meet them, obviously via virtual meetings. And for us, look, that's really been a great advantage because people are far more accessible. And rather than having to fly halfway across the world and be on a different time zone. It's been far easier to just, sit in my office and press a button on a computer and there they are. So for us, it's actually worked, quite well. And also the finance sector is absolutely prioritising discussions around health in a way that they never have. Everybody's talking about building back better. And of course, there's no point building back better to a world where 8 million people every year die as a result of tobacco. That doesn't make sense. So I think that there's this incredible opportunity to reimagine the world in a way that we want it. And we need to prioritise so many different things, including things like equality and the climate, but we absolutely have to prioritise health. It's just such a fundamental tenet of our society. And I think that people really, really understand now that without health, there is no wealth. You can't have a healthy economy if you don't have healthy people. And so it's really been a great platform for our discussions around tobacco-free finance.
Yeah, and many people argue that you were focusing on a missing link in tobacco control, that tobacco-free finance is something we did not focus before on tobacco control. And many tobacco control experts all over the world, also many people in the audience, they are probably very excited and supportive about your pledge and about your organization, about the aim. How could they get involved? Because most tobacco control experts are not part of the financial sector. This is a bit of a different world. What could they do? So if they are in a country where this is not a topic yet, how could they which steps to take?
Yeah, so it's a great question. And look, often we're approached by people in the tobacco control community who are really keen to take that next step. I think the most important thing to remember is that virtually everyone has a financial organisation. And so that's a very good place to start the conversation. Most tobacco control advocates will be part of a group. So you might be part of the Cancer Council or the Heart Foundation or an anti-tobacco charity in its own right. And you will have a financial organisation. You'll have a bank that does your banking. Your workers will have a pension plan. And so starting the conversation there is good. But as you said, because people haven't usually got a background in finance, they're often not feeling very confident around those discussions. And that's where we're very happy to partner with people in different countries and organise an event together so that we can sit down and have a discussion with some financial organisations from the local country, and we can work together to start the tobacco-free finance conversation. So if anyone's interested in doing that, I'm very happy to hear from you. You can contact me easily via LinkedIn or Twitter or on our website. And we'd be very happy to organise an event locally in your country with some of the big organisations from finance, big banks, big pension plans in your country.
Yes, and you were obviously already very successful in Australia. So at which countries can people look at? So which countries were so far the most or the least advanced when it comes to tobacco-free finance?
I would say, look, the ones that are really advanced, I would say New Zealand is the most advanced. So New Zealand has, 95% of their finance sector is tobacco-free. And it's really just expected that it's almost not even talked about anymore because it was done, a long time ago. They had a great leader. Their big sovereign wealth fund went tobacco-free in 2007. So it's 13 years ago, which is, really very impressive. So New Zealand was a long way in front of the world. Scandinavian countries have been exceptional. So, really that whole region. And then France and the Netherlands have been very advanced on this. So there's many big banks in the France and Netherlands, some of the biggest banks in the world like BNP Paribas, Crédit Agricole, ING, ABN AMRO, Rabobank, you know, some of these huge banks in Europe have all gone tobacco-free, which is fantastic. Obviously, there's Australia, parts of Canada, and we've just seen some great sort of breakthroughs in the UK. So, you know, the UK's largest pension plan just went tobacco-free a few months ago. That's brilliant. Mm-hmm. And in the States, there are pockets. I mean, the States is absolutely enormous, but there are pockets where there's tobacco-free finance, you know, in California, in parts of the East Coast as well. But that's really our focus for the next little while, because there's a lot of work to do in the US. And the concept of sustainable finance and action on sustainable finance is really just heating up in the USA.
Okay. Mm-hmm. And what do you expect for the future? So what might be like next steps? Or how do you expect that the future might look like in relation to tobacco-free finance?
I think it's really going to be like every other part of tobacco control. And, you know, if you go back to, even if you say 1999, 2000, if you go back then, we still had smoking on some airlines. And I think if, you know, when the airline sector gets flying again, but say in the next year or two, on the next time you get on a plane, if somebody next to you started smoking, you would think that was just unimaginable. It just wouldn't happen now. And I think that tobacco-free finance is going to be the same. I don't know how many years it will be, but I think that we will think it's just unimaginable that every person who had a pension plan had their money invested in companies that make products that kill 8 million people every year. I mean, it is as absurd as it sounds. But I think that in the same way we think that smoking on a plane is crazy, people had to fight for that. You know, people had to advocate for that, and they had to make it happen. And there was resistance, and they pushed back, and there's resistance, and so it takes time for tobacco control to be implemented. But once it is, we don't look back. And so I think that exactly the same thing is going to happen for tobacco-free finance. And I hope that, you know, as absolutely tragic as the COVID crisis is, I hope that it will be an accelerator for tobacco-free finance, because, you know, we have to reshape the world to be more healthy. We know that COVID is a disease that's going to be around for a while. We also know that it really attacks people's lungs, and we know that tobacco is just a devastating, you know, has a devastating impact on the lungs. So, and we've also seen, you know, huge change during COVID in the number of people who've tried to quit smoking. You know, there was a report only a month ago that 1 million people in the UK have quit smoking since the start of COVID. Here in Australia, we've had almost a 300% increase in people who've contacted the quit services and have tried to quit smoking. So despite the terrible impact of COVID on so many people all across the world, I really hope that it will accelerate the awareness in the community that we need to prioritise health, not just personally, but as a community. And as you know, as the finance sector builds back, we really need to get rid of those relationships with tobacco companies so that we can build a really, truly healthy world.
Okay, and I also have maybe a bit of a different question, so not exactly on this topic, but as you are a tobacco control advocate in this way, who is inspiring many people all over the world, who are actually your personal tobacco control heroes and why? So which people would you like to...
To acknowledge, yeah, look, to be honest, I actually want to reach out to the whole of the tobacco control community, everyone who's watching and everybody who's worked in tobacco control, because I think that, you know, if I've learned anything in the past 10 years, it's that, you know, we're up against a mighty, you know, enemy in the tobacco industry. It really is an extraordinary thing to be taking on, you know, an industry that is so deeply ingrained in so many different ways in governments across the world, in policies across the world. And it's, you know, so I really want to say a big shout out to every tobacco control worker and advocate everywhere. And, you know, often I'm up late at night in Australia, and I'm often thinking about all those people who are working hard all around the world and doing such great work, despite the fact that it takes such a long time to really see results from that work. And really, it's like a gift to the next generation. Often you don't see the impact yourself in your lifetime. Maybe it's not something that even your children will see, but it's something that your grandchildren will see. So, but amongst them, you know, I would say, you know, there have been some great supporters along the way, especially in the Australian tobacco control community. So, you know, I mean, I do want to say a big thank you to Michael Moore, to Mike Daub, to Simon Chapman, and, you know, Melanie Wakefield, Michelle Scholar. There's some amazing Australians, and Kylie Lindorf. And also globally, you know, I have a great deal of respect for Judith Mackay, who's based in Hong Kong, Matt Myers, and Robin Cabal in the USA. But obviously there's people all over the world. Martin McKee, I could probably go on and on. There's some fantastic people who, you know, constantly inspire me and teach me. So I think that, you know, during this time of COVID, it's important to keep that camaraderie amongst us.
Yes, and I often ask myself the question, because in the tobacco control community, we often look at Australia because there are just really many special people coming from your country. What is Australia making differently, or what could other countries learn from Australia to have a strong tobacco control community?
Gosh, that's a great question.
It's probably a difficult question, but many people.
No, it is. Look, it's a really great question. Look, I think in Australia, we've always, I mean, for just so long, we've had really great leaders for decades and decades who have always been willing to go that next step and go the next step and go the next step. So, for example, plain packaging legislation, you know, came into force in Australia in 2012, which means that, you know, my children have never seen a cigarette packet that is colourful. They've never seen one in their lives. And, you know, I hope that, well, I mean, I guess if they travel overseas, they might, but at the moment, they've never seen one, which is great. And I hope that that stays that way. So I think that, I mean, I think that we have been very fortunate that now we don't have, you know, we don't have an Australian tobacco company. So we don't sort of have that, you know, I guess the additional pressure that perhaps they have in Japan or the UK or the USA, where they've got local tobacco companies, and that brings a whole lot of extra complications with tobacco control. So here we've perhaps been a bit more free to be a bit bold on tobacco control. But I think in the end, you know, it is about building a community, and we've all been able to stand on each other's shoulders. And I certainly have been incredibly lucky to have had, you know, one of the big supporters for tobacco-free portfolios is Her Royal Highness Princess Dina Meret of Jordan. Yes. And she's the current president of the Union for International Cancer Control. And she said to me many years ago, she said, look, Bronwyn, in Australia, the stage for you was set. And I often think of that, in that if I didn't have those great Australian leaders come before me, I'm sure I wouldn't have been able to do what, you know, to even start the work that we've got going here. So I think it's about strengthening the tobacco control community and lifting people up who are interested in the topic, and helping them make the biggest impact possible.
Yeah, thank you. And maybe as a last question, because I think we could talk like for a long time, but we had the aim to keep it short. Is there like one last point you would like to discuss? Something which might be interesting about tobacco-free finance pledge or portfolios, which you did not mention yet, or what would be like the last topic you would like to focus on?
Well, I think the other topic that, I guess the other thing that some people, a bit of a myth that some people think, is that they have to lose money if they change the way they invest and change from a more standard investment to tobacco-free. But in fact, that's not the case. And over certainly the last 3 or 4 years, we've seen that tobacco-free finance, in fact, outperforms or does better than investments that have tobacco in them. So I think that I just want to check that you haven't frozen or I haven't frozen. Oh, Oh, well, I'm going to keep going just in case you can hear me and it's you who's frozen. But I think that that's the message. You don't have to lose money or take a cut. You can, in fact, get excellent returns. In fact, in many cases, even better by being tobacco-free. I might just say goodbye to the audience. So thank you so much for joining us. Please feel free to reach out. So my name's Dr. Bronwyn King. I'm very pleased to meet you on Twitter or LinkedIn, or the Tobacco-Free Portfolios website. I wish you a very good day or very good evening, depending on where you are in the world. Thank you and goodbye.